What we're talking about today is 5 things related to skin removal surgery after weight loss. So I have loads of patients that come to me that have lost weight either through healthy diet and exercise, surgery, weight loss medications. And so what I'm gonna do today is go over 5 common things that we talk about that can help you on your journey. So the first thing is, who makes a good candidate for skin removal surgery after weight loss? This is gonna be somebody that has accomplished their weight loss goal, or is usually within 10 to 15 pounds of there, and has been steady at that weight for at least 3 months, and has something on themselves, whether it be arms, legs, tummy, really anywhere, they feel like that weight loss has resulted in excess skin that is causing rashes, not allowing them to wear the clothes they wanna wear, just getting in the way of them feeling how they wanna feel about themselves. And so then we can chat about what your options are to rid that from you. The next thing is, how long after my weight loss should I wait to have surgery? So from my perspective, it's probably best to hold off on your consultation until you're pretty close to where you wanna be. So that way I have a good idea of where your body's gonna be at surgery. If you still wanna lose 50 pounds, I don't know if that's gonna go more from your arms, more from your legs, more from your tummy, so it may be hard to gauge the areas that are really bothersome to you, so being closer to your goal is helpful. Then, being at a steady weight that you're happy with for 3 months allows the skin that you're not liking to kind of maximally retract as much as it's going to, and we can get the best idea of what the correct procedure is going to be for you to accomplish your goal, as there's usually several different things that can be done depending on what exactly your complaint is. Maybe the most common question I get when it's related to weight loss is, do I have a BMI requirement? And short and sweet, I'm gonna say yes. This kind of frustrates some people, but if you'll allow me to elaborate, I think we can probably get to an understanding of why. So we all know BMI is not the best measurement of anything, but we kind of have to start somewhere so that we have a common language to speak, so that the likelihood of you coming to see me and asking for something, that I can actually give you a result that you're happy with for a really long time. So in the broadest of terms, and this may not exactly apply to everybody, if you're less than 50, BMI should be under 30 for a skin removal procedure. Now, I don't want that to sound like it's a punishment to folks, but what you will find is if your BMI is much higher than that, the likelihood that you're gonna get an outcome that you are not happy with is so much higher. So I really want my patients to be thrilled, be shouting from the rooftops how happy they are at the surgery they got. And if we're not having you set up beforehand for those kind of results, then that's just not gonna happen. You're gonna be sad, I'm gonna be sad. We don't want any of that. So like I said, at the most basic of terms, if you're less than 50, BMI of 30, if you're close, go ahead and call the office. We can chat about if you're just on the cusp and we'll get you in anyways, or if there's other things that we can do to encourage you to get those last couple of pounds off. Next question I'll get is, folks will say, I've done so much work, I've worked so hard, I've actually gotten to the goal weight maybe since I was a teenager that I've been trying to get to. How can I get the best outcome? So from my perspective, optimal outcomes come from a few things. The first one I already said, being at the goal weight that you want to be. Second is living a general healthy lifestyle like your mom told you to do, like your doctor tells you to do, eating a good diet, not smoking, doing some exercise, those type of things. Next is, we're going to go through medications and such, supplements that you may take, that we may need to have a brief period of stopping around the time of surgery so we can minimize the risk of complications. So those things put together really help get you the best result that you can in my hands. Another common question is, a lot of times when people lose a lot of weight, there's not just one area on their body that's giving them trouble. So I'll frequently get, I don't like my tummy and my arms, or my tummy and my legs, whatever it may be. Can multiple procedures be done at the same time? So my short answer to that is yes, with the caveat of yes, so long as we can do it safely. So it's exceptionally common for me to do, a breast lift and an arm lift, or breast lift and tummy tuck. Really any number of combinations that you can think of at the same time, so long as, like we've discussed throughout this video, you're kind of optimized for surgery and we can do it safely, so that way you're not struggling with complications after surgery. If this video resonated with you and you want to share your experience as related to it, comment below so we can continue the chat in the comment section. If you want more content from me or the other doctors at the practice, we have a podcast that's coming out that you can watch on YouTube or across anywhere that you get your podcasts. If you're ready for more information about this video or other things you've seen me talk about, you can call our office or visit our website, both linked below.